Why am I bloated? Bloating can be very frustrating and definitely uncomfortable. Um, in my last two videos, I spoke about 10 foods you should avoid if you want to reduce gas and bloating. In this video, I'm going to be talking about some underlying causes that might be causing your bloating and some maybe other digestive issues. Hi, everyone. Thank you for those who are joining me live and those who are watching the recording. My name is Moran Hermesh. I am a functional medicine nutritionist. I help adults struggling with digestive issues, skin issues, immune health, unwanted weight gain to improve digestion, clear up skin, increase mental clarity and energy by identifying food triggers, reducing inflammation, and healing the gut. You know, many people think or believe that, bloating is one of those digestive issues that you just need to learn to live with, that it's natural, kind of like a natural side effects of digestion. What do you think? Is it something that you should learn to accept and live with, or is it something that you should try and get rid of? Let me know what you think. So, I want to talk about some potential underlying causes of bloating. And the first one that I want to talk about is low stomach acid. Now, having low stomach acid can definitely contribute to bloating. So, specifically, if you are experiencing bloating and belching immediately after a meal, that's could be a sign that you have low stomach acid. Now, what could be a reason for having low stomach acid? Well, there are few reasons, but one common one is really taking acid blocker medications for a long period of time. And I'm talking about medications such as omeprazole and Prilosec. And why do people take these medications? Well, usually people will take these medication when they experience a heartburn. Heartburn, where you have this like unpleasant burning pain sensation in the chest. So they would try and get rid of this burning unpleasant sensation by taking acid blockers, which reduce stomach acid. But here's the thing, yes, you might get a temporary relief, but you actually need stomach acid for healthy digestion. And blocking it can really lead to a serious bloat. So how does it lead to a serious bloating? Well, the acid that is in your stomach helps break down food. It also protects you from harmful bacteria that can enter your body through your mouth. And drugs such as proton pump inhibitors or PPIs and other type of acid blockers, they change the pH of the stomach from acid to alkaline, which creates a really nice environment for bacteria to grow and produce gas, also known as bloating. So what would be my recommendation? Well, my recommendation would be to not take acid suppressing drugs for more than a few months. And if you're struggling with a heartburn, find the root cause, find the underlying issue that is causing your heartburn. Or you can try some really easy home remedy solutions, such as take 1 tablespoon of apple cider vinegar with each meal. You can also try and take some digestive enzymes with HCl with meals. So definitely low stomach acid could be a cause of bloating. Now the other underlying cause of bloating I want to talk about today is IBS, or irritable bowel syndrome. I was very surprised to learn that so many people suffer from IBS in this country. It's about 10 to 20% of people. That's a lot of people. And usually people with IBS, they will complain about symptoms such as constipation, diarrhea, or both. But, mostly everyone who suffer from IBS will complain about bloating. So, IBS is a really complex disorder. There are many causes and triggers of bloating for someone, with IBS. So, but some of the major contributor can be, low-grade inflammation. Maybe you have an imbalance between the good and the bad bacteria in the gut. Maybe there's changes in the way the gut and the brain communicate. Definitely food intolerances and stress. Stress is really, really a big one. So in functional medicine approach, we want to find out the root cause. And so you want to find out, do you have an infection? Do you have food intolerances? Do you have an imbalance between good and bad bacteria in your gut? Do you have low stomach acid? Are you not breaking down your food properly? Take a closer look at your diet. You want to identify your food triggers and intolerances. Definitely follow a low FODMAP diet, which I talked about briefly 2 weeks ago in my video. You want to manage your stress level, and you make sure to really get a good night's sleep. Now, many people who struggle with IBS actually have SIBO, which is small intestinal bacterial overgrowth, which is definitely a contributor to IBS and to bloating. It's actually estimated that SIBO could cause 60 to 80% of irritable bowel syndrome. So what is SIBO? SIBO is when large amount of bacteria that is supposed to be in the large intestine usually ends up in the small intestine. So now you have an abnormal number of bacteria present in your small intestine. And these bacteria, they ferment starches and fibers into gases, causing bloating. How does someone get SIBO? Well, remember the antacid medication and low stomach acid condition that we just talked about? Well, that is one cause of SIBO. And other causes could be frequent intake of antibiotics and slowed gut motility. Now, in order to treat SIBO, we need to kill the overgrowth with either antibiotics or, herbal antimicrobials. And for that, you will need the help of a professional. So, that's it for today about underlying causes of bloating. And, next week, I want to invite you when I talk about leaky gut, because bloating can be a symptom of leaky gut. So join me. I will talk about what is leaky gut and how you can tell if you have leaky gut. Bye now.